Excellent. So thanks everyone, and thanks Guillermo and Debbie for inviting me, and to Catalina for facilitating bringing me on over. So I'm here to chat about the public charge rule, the history of it, and the impacts of the recent change. And just as a little bit of context, you all, I'm unsure of how familiar you are with the rule and the complexities of it, but it has tremendous impact on people accessing social services. It's very impactful to Hopelink, the work that we do here, the comfort and trust that people have in accessing services, and it impacts pretty much everybody in the sector in some way. So at Hopelink, it's really important to us to make sure that as many of our staff members as possible understand the implications. And so I really appreciate getting to give this presentation, because we're also passing this on to the rest of our staffs. So I will admit to you all, this is a little bit of the first time giving it. So I appreciate any questions that you might have, because it can help inform anything that we might need to brush up on in the presentation. But I'm going to go ahead and share my screen. Can you all, is it all sharing for everyone? Excellent. All right, so to jump right in, we're here to talk about the public charge and immigration enforcement. And just to open up, this is a graphic that we share that we've put out on all of our buildings to help break down some of the mistrust and reassure folks that we are genuinely here to serve everyone. We do like to emphasize this is just a good reminder to give in all services to make sure that anything that we can do to help welcome folks a little bit more, we try to spread that around in our graphics and signage, et cetera. Now, what the public charge rule is. Like everything in US law, it's complex. So the public charge rule is a US immigration rule that allows immigrant status to the United States to be denied visas or permission to enter the US if they're likely to rely on public resources. And it's made up of a combination of laws and administrative decisions. Now, if it were just a law, it would be easy to focus on our legislature, lobby our legislature. If it was just an administrative decision, it would be easy to focus on those rules. Given that it's this complex mix, it is much harder to communicate out what the rules are, and a lot more complex to advocate for change around those rules. So the history of the rule, now a lot of us started hearing about it a whole lot more with the changes in 2019, but the rule itself has existed since 1882 in various forms. And you can see the law itself has changed every 20 to 30 years over the last 100 years, 1903, 1952, 1965, and 1996. It's kind of one of the change that impacts us most now. But through all of these changes in the law, there is significant leeway in how the executive branch applies the law. So the law defines that immigrant status can be impacted by likely to be reliant on public resources, but it leaves it up to administrative groups to decide what exactly that means. That means it can change more often than if it's something that has to go through Congress. So more recently, under the Trump administrations, the benefits which were considered were expanded to include SSI, TANF, SNAP, Medicaid, and public housing assistance. Now, there were some exceptions and limitations to this, but it's a lot of paragraphs. It's a lot to understand. But this expansion, I'm sure you can see these are programs which a lot of Americans rely on. SNAP is a resource. Hopelink has always encouraged everyone, go get SNAP by all means. It's there. It's fairly easy to apply for. We want everyone to get SNAP. And so this change to suddenly include that as part of the public charge rule impacted communities significantly. It impacted fear significantly. And within this, the complexity of the change caused fear of using these programs amongst many immigrants, including citizens. So this change from the Trump administration, I have it here in fairly simple bullet points, but there is so much more to it. And we all, nobody understands it really fully. And so there's naturally going to be fear in accessing any service. Things like education programs never impacted the public charge rule, but it's very reasonable for folks to wonder, is using this program going to potentially impact my immigration status? So even more recently, in September 2022, which was just 2 months ago, a month ago. So the USCIS announced that they are no longer applying the 2019 rule and are going back to the 1999 interim field guidance. This was released, in 1999. It's what the administrative branch was using for ever since then. Programs, a lot more programs were used to those rules and more easily communicating them. Now, this means SNAP, public housing, and Medicaid, and always with some exceptions, are no longer considered. TANF and SSI are still included in the services that are considered, although there are limitations on that as well. Now, thankfully, the USCIS has provided a reasonably easy to navigate resource page explaining this in greater detail. And you can see each of these underlined things are links, and I think we're going to be sending out those links so that everybody can reference that. I do encourage anybody who needs to be able to communicate out these rules and how they work. I encourage you to check out that interim field guidance. It's dense language, but it's only 3 pages, and it does explain in fairly good detail how this will be applied. And the resource page even easier to soak in. So in summary, the public charge rule does still exist. I know I heard on social media, with the more recent change, like, oh, it's rolled back. But folks do need to understand it is still a rule. And it is the ongoing changes do make it hard to understand for service providers, potential clients, members of the public. Anytime something is changing all the time, it's hard to track. Now, and another thing, I hate to just reemphasize this over and over, but we can now fairly confidently say exactly what programs, what services do apply to the public charge rule. But the 2019 change did demonstrate that that can change quickly. It's up to whoever is running the USCIS, whoever is in the White House. That changes every 4 years. And so there's no guarantee that programs that do not apply to the public charge rule now won't apply in the future. Now, we can be fingers crossed. In the 2019 rule, past use didn't apply to the future, but there's no guarantee that that is also going to be the case. So now, I'm not here just to talk about Hopelink and what we do, but we do strongly recommend our approach is to take excellent care of any client identifying data that we have and avoid releasing it to outside parties. Now, what that means is we have funders that want to know how our programs are performing. We only release any information that could identify a client when we absolutely have to in order to administer a program. For example, we operate some programs where we submit a name and another organization will will provide the funding or the service, or in almost all cases, we provide anonymized data to our funders. So while we can't guarantee that one of our programs won't apply to the public charge in the future, we can guarantee if we are the only people who have that data and we don't give it to anyone else, then there's no way that USCIS, that any kind of immigration enforcement could use that information. So we work very hard to understand where our data is and not release it to other folks. That said, we do, like I said, there are some programs where the data does have to be released, and we work to make sure that we can communicate that very clearly to any program participants. Now, to talk a little bit about how this rule impacts clients, service providers in general, and Hopelink specifically. Now, as of September 2022, clients who don't use services that were addressed in the 1999 interim field guidance will not be directly affected by this rule. Now, at Hopelink, I recommend against telling people directly what program will or will not, because it is complex. And I do not want to ever give false information. I only want Hopelink to be giving facts that we are 100% sure of. So we can speak to our programs, but we avoid giving advice on, other programs, SNAP or this or that. But if an individual is not using any service addressed in that, they're not directly affected. But this has affected Hopelink, and it's affected service providers all over. The complexity of the rule can foster fear of accessing services. Just how hard it is to look at that rule and understand and know that it changed in 2019, it changed in 2022. It has led to a chilling effect in accessing services. Folks who aren't impacted in any way by the rule, we've heard that they're more afraid to access services. And this includes folks with citizenship. This includes, it's across the board. There was a chilling effect in accessing services. Now, for service providers, we strongly recommend service providers should understand with confidence whether or not their programs are considered as a part of the public charge rule. And I think Hopelink has a whole array of services, so that it takes a fair amount of research for us to look at each one of those. But I think many providers with more directed programs, it never hurts to double check and make sure that it's never applied. Service providers should understand fully where their client goes and be ready to explain this confidently to clients. Some service providers, their data does leave their walls there, and understanding exactly who takes care of that, understanding exactly how it's used, giving those facts to people who want to know, rather than I promise it's okay, will help build trust. And service providers should understand and be compassionate with clients who are fearful of public charge related implications. So at Hopelink, we work really hard to make sure nobody ever says like, oh, I already explained to you, it's fine, it's not going to affect you, why are you still afraid? We need to understand that this is it's complex, and we need to work to build the trust with folks that these rules have eroded the trust for. And Hopelink specifically, so currently no Hopelink services at all are considered as a part of the public charge rule. The only Hopelink program which was considered under the previous rule was a set of, we have 4 federally subsidized housing units. So in our tens of thousands of clients, there were 4 folks that this could apply to, and we made sure that they were absolutely fully informed. And of course, like everything is, there's a little more complexity to that. We do provide non-emergency medical transport for Medicaid clients. So Medicaid clients, that their participation in that program did under the previous rule qualify under the public charge. The new rule does not. Now, their use of non-emergency medical transport did not increase any implication. So we can confidently say we only have 4 housing units that were impacted. So to move on to just sharing a little bit about what Hopelink does about this. I've already referenced some of these things, but things for folks to know about what Hopelink does is we share our client data with government agencies only where absolutely necessary for service delivery. And off the cuff, I can name, what those organizations are for some of our programs. I haven't included in the presentation, but for example, our energy support program, the state remits that money, and so they do need to see client records. It goes into the LIHEAP database. Now we have received assurance from the state government that is never transmitted up to the federal government. So we also have some housing programs with a similar setup where it goes to the state, but we work to limit any sharing of our client data. And we always explain to clients how their data will be used and where it will be stored. And we ensure that staff understand the rule and how to communicate with clients about it through trainings and presentations. And this one will be delivered to a large group of our staff next week. So we want every one of our staff members to be able to communicate. And an example of the kind of information we share out. So this is just guidance that we give to clients or to staff in how to communicate with clients, because you can put up signage and give people papers to sign and say they agreed to it all day, but the one-on-one communication is often how folks can get their questions answered and be reassured and build trust with an organization. So we got staff to always be empathetic and compassionate. And we really want to stick to Hopelink is here to help folks access our service and connect to other community services. We welcome and value all members of our community, regardless of country of origin. And we do urge staff to avoid communicating in a way that could increase fear. Now, many of us at Hopelink, all of us at Hopelink, have personal feelings that the public charge rule is bad, shouldn't exist. We don't like it. But we avoid making judgment on the rule because that can make it seem like an even scarier thing. We try our best to focus on facts and compassion. Now we try to just stick with Hopelink's advocacy position is against the public charge, and we do advocate for its change in the ways that are available to us. But we avoid being, adding too much negative conversation to it and go back to focusing on the facts. We also encourage people to access the service that allow them to meet their needs. We don't want fear of the public charge rule to lead to people being hungry, cold, or without housing. So while at Hopelink, we always, we honor people's, we want people to make decisions for themselves. We don't want to try to pretend we can make decisions for them better than they can, but we do what we can to encourage folks to make use of the services. We don't want anybody going without. And we give this guidance to all staff about what to do if we ever do get a visit from immigration enforcement. Now at Hopelink, this has never happened, but we do not ever want to come up with this procedure because it happened. So we want staff to be prepared even no matter what. And so, this is just a fairly clear, we allow them in, but get them into a private space. We get our highest level of leadership and have them deal with it. And we work to keep any government agents in a nice private space hidden away until we can have our executives. And I can say with confidence, our executives will come in quite firm and fiery to address this, and we'll be there very quickly. So we give this guidance to staff to help them feel reassured. We know what to do. We have a plan, and it's never happened before, and fingers crossed, it's not going to happen in the future. But this is an example of the guidance. And okay, so that is that's the end of the presentation. Now, we did want to share both my contact information and Catalina's contact information, and I wanted to welcome y'all to reach out to either of us or both of us. So additional questions about the information that I just shared. I'll open up the chat in a moment. I see some dots there. So if there are questions that I can answer, I will hit them up. But if you have further questions down the line, suggestions, thoughts, we would welcome communication, and we will do what we can to answer any questions that come up. And it looks like the messages that I see are contact information and links that Catalina shared. So I will pause if anybody does have any questions.
If you have any questions, you can just unmute yourself and just. Gabby's asking a question in the chat that say, are you hoping to share information in multiple languages?
So sharing information in multiple languages, we, as it is now at Hopelink, we haven't published information about this besides the that flyer that that poster that I shared in the beginning. Now that clearly does not go in depth about the complexity of this rule, but that is something that we put in many languages, and we have not published written information about interpreting this updated rule. But frankly, this question is, Catalina and I will probably touch base about that one later. So as it is now, we don't have plans to do that.
And do you know anybody has plans to do that? I know that, I mean, it's too much pressure to put in Hopelink to inform everybody in different languages, but that somebody's doing it.
So the USCIS resource page that that Catalina shared a link to in the chat. So I'm always very hesitant personally to publish like reinterpreted legal information, not being a lawyer, and just out of that fear of accidentally communicating something that is erroneous. For the time being, I do recommend that USCIS resource page, which I believe is available in a number of languages.